Hi, this is my reporting out of assessments video. My husband is away. He was supposed to be my parent guinea pig. Since he is gone, I have Mr. Pickle sitting in, a guest from Vegas, who will be acting as the parent for my video. Good afternoon, Mr. Pickle. I'm really happy that you could come in. I know that you had some concerns about your daughter in regards to her math, her reading, and her writing specifically. So we decided to do two different tests on your daughter. When we did these, she seemed very focused. She seemed calm, and she seemed very eager to do her very best. So I feel that these are accurate representations of her ability. In math, there were some concerns in the classroom setting. However, when we did the key math, which obviously is a one-on-one test, she did very, very well. In fact, in many cases, she placed above average. So as you can see on here, we tested her enumeration, we tested her in algebra, geometry, measurement, and probability. Then we went on to test her in estimation, addition and subtraction, and multiplication and division. And after doing the questions, we charted her results on this graph. Here, I'll just show it for the camera. And you will see that in each of those areas, she placed in what we would call the average category, and not below average, but right in the middle of that average category. And where she didn't place average, she actually placed above average. So in enumeration, she was average. In data analysis and probability, she was average. And when I say average, I'm talking grade level. So for a 12-year-old girl in grade 7, this is what we would expect the average student out of a sampling to obtain. And then she was above average in the other category. So she placed above average in algebra, she placed above average in geometry, in measurement, in, I'm just having a hard time reading that, in mental computation and estimation, in addition and subtraction, in multiplication and division, as well as in her basic concept operations. So this seems to suggest that even though she appears to be struggling in class, it may be more anxiety related. It may be she doesn't feel comfortable in the full group. So we're going to do a little more work in small groups just to see how this plays out and take it from there and see how that goes. But right now, according to this particular math test, we do not have concerns about her being below grade level or struggling. She seems to be achieving well, in fact, very well in key areas for the grade 7 math curriculum. The second test we did was the Peabody Picture Vocabulary Test, and this tests her vocabulary skills. Again, we're testing it for her grade level, for her age, and we're basing that specifically on her chronological age, so the fact that she is 12 years and 3 months old. So when we did this test, again, we plotted it on a graph, and I'll show that for the camera. And here, she scored, again, in the average category, but you'll see that she placed just below the middle of that average category, which in this particular instance is called low average. So again, we don't see any reason to be concerned. In fact, she seems to be operating, functioning at grade level, appropriate level in language arts. As I said before, the same in math, even higher in math. And so because she has experienced some difficulties in class, and what we're seeing in class doesn't mirror what we're seeing on these assessments, we are going to put in place a smaller group for her to work with the LST teacher, the EA, and we're going to make a group of about 6 or so kids. And we're just going to test that out. We won't do that every day, but we'll do that sporadically. We might do it for the odd testing or math fact day, or maybe a quick write in English class, just to see if we are going to get similar work to what we saw in these tests, which has been different to what we've seen in the class. And then we will have another team-based meeting so that we can discuss this further and possibly proceed with further testing if need be, whether that's testing related to anxiety, whether that's testing where she sees a pediatrician, or whether it's testing that has to do with academics, which we're just not sure we want to do that quite yet until we see how she does in a small group versus being in the full class as she usually is. So, just wondering if you had any questions. If not, that's fine. And we will give it about a month, I would say, and then we will call you again and arrange another meeting and see where we will proceed from there. I really appreciate you coming in today. It means a lot to me, and I thank you for your time.